So I welcome Dr. Lucy. She'll be presenting on amblyopia. Okay, she is working at Thaliath Hospital, Kozhikode.
Okay, coming to first, I would like to thank KSOS for giving me this opportunity. Coming to amblyopia, as you all know the definition, this is a decrease in the visual acuity for which no causes can be detected by physical examination. And according to AO, if there is a difference of line difference between the two eyes, or if the visual acuity is less than 20/30, it's considered amblyopia. And these are the various causes based on the etiology. Why is it necessary to treat? Because it's psychologically distressing. It doubles the risk of when the other eye is when the other eye loses vision. Treatment improves the quality of life, and in certain careers, 6/6 vision and good stereopsis is required. Visual acuity recording is the first step in amblyopia treatment. We have different charts depending on the age of the child, and we have to have a crowding vision recorded because the other charts tend to overestimate vision, and we have to have a thorough examination of the anterior segment and posterior segment to rule out the organic causes of amblyopia. The aim of our treatment is that the right eye, both eye vision becomes equal, and the treatment is said to be successful when the difference between the two eyes is within one line. And it is mainly based on, first step is the optical correction, and the next step is to make use of the amblyopic eye. Most of the treatment guidelines are, these are the various options, and most of the treatment guidelines are based on the pedic group study. And coming to the first step, that is the optical correction. It is the initial step in care of children 0 to 17 years of age with amblyopia, and a good percentage of children with anisometropic, ametropic, strabismic amblyopia improves. There is at least a 2-line improvement in these cases. And we have to do a full cycloplegic refraction, and in hyperops, full hyperopic correction have to be given. In the when after prescription, the visual acuity improvement occurs during there will be a steep increase in the visual acuity during the 4 to 12 weeks, after which there is a plateau phase, and then it gradually, very slowly improves. I'll come to the case later. Now, about the next mode of treatment, that is occlusion therapy. Here, we prefer self-adhesive patches than the cloth patches, because young children tend to peek over this patch. And the next question, when you think about occlusion therapy, which comes to our mind, is how much to patch. In studies, severe amblyopia, 6 hours patching has shown similar results as full-time patching. And in case of moderate amblyopia, 2 hours patching has similar results as 6 hours patching. And if after 2 hours of patching there is no improvement in the visual acuity, increase time. And you have to consider patching if in older children, if they've never undergone patching, if not, and they are not very regular with that treatment. Also, you have to encourage near activities of 1 hour, and whether to start patching and give glasses at the same time, or to wait for some time and then start patching, is still not very the same. And for younger children, it's always better to start sequential, because it is to reduce the load of the patching therapy. And when to stop? When the visual acuity in both eyes becomes equal, or in case of strabismic amblyopia, when the fixation becomes fully alternating, or there is no improvement despite 3 to 6 months of patching. And when you stop patching, gradual tapering should be done than stopping abruptly. This is a very ideal case which comes to our OP. This is a 5-year-old with a defective vision detected in school screening. Right eye vision 6/6, left eye vision 6/36, best corrected visual acuity 6/18. No anterior segment or posterior segment pathologies. She was prescribed glasses, the same power, and after 2 months, the child comes back with vision left eye improving to 6/12, and she was again advised to continue patching for the again to after 2. She was advised patching 2 hours, and she was advised to come after 2 months. And now her vision is crowding vision is 6/9. She was advised to continue, and she comes back after 3 months with 6/6 vision, and then she was again reviewed to rule out recurrence, and it confirmed 6/6 vision, and then she was reviewed every 6 monthly. And now coming to the next mode, that is atropine penalization. It is a similar treatment effect as patching. Daily atropine administration is not necessary. A twice per week schedule is also effective. It is appropriate for both first line treatment and for patching failure. And various drugs are available in our market, which has been tried for amblyopia, citicoline being the most common one. It has neuroprotective effects, and the other drugs are fluoxetine and donepezil, which is still under investigation. And though some pharmacological treatment options and in particular citicoline have been tried, but still long-term studied are needed in future. And coming to the various newer methods, this is liquid crystal glasses, which provides intermittent occlusion, and alternate one lens between the opaque and the transparent lens. And
Dr. Lucy, can you just conclude? We have one more speaker actually. The session is up.
And next method is the perpetual learning. Methods based on perpetual learning. We have the revital vision therapy. Here the GABA patches, it's a software based, but GABA patches have been used to stimulate the occipital cortex. And the next common therapy is the dichoptic training. This is a true binocular treatment where you can improve the stereopsis also. Here we reduce the fellow eye contrast to balance the to rebalance the contrast between the two eyes. Various games are available based on the dichoptic therapy, which and the one we use is the binox therapy. And video games can also be used for patching dichoptic treatment and to also to develop stereopsis. This is another mode of treatment, that is transcranial magnetic stimulation, which results in temporary neural excitability. And orthoptic magnocellular stimulator. Here, multiple areas in brain are stimulated, which in turn stimulates a vision center. It's found to be effective in anisometropic and strabismic amblyopia. And not to forget about the artificial intelligence-based KSOS2023. And follow-up is very important. It's usually done in amblyopia, it's usually done at 6 to 8 weeks after giving glasses. Then you have to initiate therapy. And again, after 8 weeks, we have to check for if there is no vision improvement, we have to check compliance and then increase patching time or change mode. If better, you have to continue the same treatment. Okay, I think I'll skip the cases.
No. It's done.
Thank you.